Okay, hello and welcome to April's info share. And you could see we have Tony with us, so it's just going to be me and Cassandra from the training team, and we have Tony who's going to take up the whole hour, maybe Tony, I don't know. But we have Tony here, and I'm just going to keep letting folks in. If you could just quick reminder, mute yourselves. And then if you have questions or comments for Tony or us, you could put them in the chat, or you could raise your hand and speak. I think Tony's going to pose every now and then just to give folks chances to ask questions. But Kara's out and Damon are out on leave, so we're stuck with just skeleton crew over here. April, Cassandra's gonna manage the people in. And again, a reminder to mute yourself when you're joining. And I don't know. I think that's about it. Tony, do you want to take it away? And we'll be muting folks as we see fit. Thank you.
Hi, Kat. Thanks. I'm Tony Newman. I'm the director of the Division of Senior and Disability Services. Hi, everybody. Kat, I don't know. You just introduced me by first name, so maybe I have I'm like Cher or Sting or something.
You're like Prince, you know.
Just need
like
one.
That. Yeah,
one
just Tony. Everybody knows. And if they don't know, then.
I've been the director at SDS since 2022, and I'd like to try and come to these info shares now and then. And Kat and I were talking, and we realized it's been a while, so here I am. I primarily am just interested in some discussion, hearing what's on your mind and what's on your plates as care coordinators. As always, I'm extremely grateful for the work you do as the advocates for Alaskans with disabilities and seniors. So I'm eager to hear how the work is going. But we thought to start off and warm all of us up to some conversation, I would just let you know about some of the things that are going on here at the division. So let me just give you updates from what I'm doing. First of all, I'll talk about federal action. Lots going on federally. If you read anything or see anything, you probably know that. Just with closures and reductions and consolidations of federal offices and programs. This morning, we received word that that our regional representative at the Administration for Community Living received her reduction in force notice. So that's somebody that I've gotten to know well and worked with over the past number of years. Really has done a wonderful job helping us understand primarily the Older Americans Act and the grant funding that we receive through that federal law. So anyway, we're not sure what her departure is going to mean programmatically or operationally. We do receive millions of dollars in grant funding from the Administration for Community Living that gets passed through to senior centers and other grantees that, Meals on Wheels, caravans type services. These are grant funded services. We haven't heard that the grant funding will be reduced at this point, but we are certainly keeping our eyes open because changes are coming fast and furious. And so every day I wake up, I'm not quite sure what I'm going to learn. That's what's going on there. We heard today about another office called the Administration for Children and Families, also housed under the Federal Department of Health and Human Services, has also been drastically, I think it's been eliminated, and the duties of that agency are being distributed elsewhere. So I know care coordinators, of course, work primarily in Medicaid, and right now, again, lots of smoke, not a lot of fire. Congress is considering cuts to Medicaid as part of a broader plan to cut hundreds of billions of dollars over the next 10 years that could impact Medicaid. Again, we don't know. But the commissioner's office has been working on potential scenarios around if Medicaid were to be cut or changed drastically, what that would look like. So trying to set up scenarios like, well, what happens if the feds reduce the federal match to Medicaid? What happens if they make work requirements a part of being eligible for Medicaid? What if they implement provider taxes as part of the desire to sort of get states to pay up more for Medicaid? One idea we heard was maybe Medicaid needs more frequent eligibility checks instead of annually. Maybe that should happen every 6 years. As you all know, our Medicaid eligibility is determined through the Division of Public Assistance. The proposed changes to Medicaid, like I've just described, that I've heard, I haven't heard anything that would really impact SDS recipients too directly. But for instance, when people talk about work requirements, it's often noted that there would be an exclusion for people on long-term care Medicaid, or aged blind Medicaid, as it's sometimes called. But you know, as you all know, our Medicaid eligibility begins with the Division of Public Assistance, and therefore, if you're going to change what's going on in terms of Medicaid eligibility, you're gonna impact DPA's work, and even if services for SDS beneficiaries remain in place, even in the worst case scenario, you know, if DPA experiences delays or disruptions, then downstream we could too. So that's just the concern that I have an eye on with regard to proposed Medicaid changes. Is if eligibility criteria change there at the Division of Public Assistance, then how will that hit us downstream? Kat, I'm gonna let you interrupt me if there's a question that comes up in the chat or anything like that that's on
You're
topic.
okay. You're okay for now. There's no questions.
Okay, thanks.
Yeah.
Let's see. So we had a bit of a fire drill here a couple of weeks ago when a potential shutdown of the federal government was looking really possible. We had to scramble to do a bunch of work to explain the impacts if the federal shutdown happened. But as you would know, if you're watching the news, in the last hours, Congress passed a continuing resolution that's going to go until September. So even though we had to do a lot of work and it turned out the shutdown was averted, the information we gathered up was helpful to do and may come in handy if come September a long-term solution to the budget hasn't happened. I will say, just for people to just put in the back of their heads, that if a government shutdown were to occur at the federal level, we would probably be okay for several weeks to manage that, as you know, our payments system with the federal government has a several week delay. So, but if it goes on over 30 days, that would be a concern. So that's kind of the magical number that I keep my eye on, is a federal shutdown lasts over 30 days, then there would be real concerns about the department's ability to meet its obligations. So hopefully that won't be an issue ever, but just wanted you to know, as it's something that we're keeping an eye on here at the department. One of the reasons I'm really grateful for the department's current leadership, Commissioner Hedberg, Deputy Commissioner Ricci, well, they are planners, and they are sort of well, if you were paying attention to the COVID press conferences that were had a couple of years ago with Dr. Zink and Commissioner Crum, you would have seen former Deputy Director of Public Health Hedberg as part of those conferences. So the commissioner has a real gift for emergency services management, and you really see that skill put into motion with what's going on at the federal level. She's contingency planning, trying to make sure we're on top of things. And most of all, she's, as you know, if you've met Commissioner Hedberg, she's a very positive person, and she keeps our spirits up when we're feeling like things could go in any direction. So I'm grateful for that. She's planning as much as possible, as it's possible to plan for the unexpected. All right. So I wanted to just touch base and give you guys an update as to what's going on in the legislature. That's something that takes up a lot of my time this time of year. Right now, we're primarily keeping our eye on the state budget. The governor introduces his budget back in December, and now the legislature has their way with it. It's in the House of Representatives right now, and they're proposing amendments, suggesting changes that go in and out. I'm a little bit hesitant to get specific about some of the budget amendments that they've made because sometimes they get proposed, but then they get pulled right back out again. Sometimes they're floated and never really introduced. But generally, as far as the state budget goes, what I've seen is that there's a lot of interest this year, thanks to stakeholder work by the Key Coalition and AADD, Governor's Council on Disabilities, and Peer Power. There's a lot of interest this year in the infant learning program and recognition that the infant learning program has been flat funded for many years. There's been a lot of advocacy around trying to increase funding for that. And so right now in the draft budget, there is some increased funding for the infant learning program. We'll see if that stays in there. There's also increased funding for grants for senior centers, for adult day programs. A couple $1 million are proposed to be added to the budget to help senior centers and others do a better be able to keep up with the demand for their services, like Meals on Wheels, transportation, as well as respite and adult day services. So there's real interest and advocacy around that. There's been some advocacy by assisted living homes that offer general relief. You may know our general relief program. It's not a waiver program, but the general relief for assisted living homes program is a way that people in financial distress, often homeless, can be placed in assisted living on a temporary basis, and then the money goes toward the assisted living home to take care of them. There's a push to try and increase the rate for that program as well. So those are some of what's going on in the budget that we're keeping an eye on. There's two bills that I'm really tracking closely. One is a bill that was put forth by the department and creates a new setting called a complex care residential home. The numbers on that bill are Senate Bill 76 or House Bill 73. So there's two versions, one in the House, one in the Senate. And that is a bill that's the department is putting out there as part of its ongoing effort to do better by those individuals with complex care needs, behavioral health challenges, as well as disabilities, maybe OCS involvement or criminal justice involvement. The bill is being well received. All the bill does is creates a new setting type. All it does is create a new license type, like an assisted living home. It's similar to the way we created a new setting type with adult host home care a couple of years ago. And then if the legislature approves the addition of this new setting type, then we will begin the work of figuring out how services can be offered in that sort of setting, the complex care residential home. We don't know if waiver services would be eligible to be provided in that kind of setting yet. We don't know how it'd be funded, whether services in such a home would be funded or not. But the idea is, first, let's create this setting, and then we'll begin to explore the kinds of services that can be offered in it. Because there's a real need for people, particularly people in the Alaska Psychiatric Institute, who've been there many months, sometimes years, who don't have anywhere else to go because there's nothing that's just a little bit lower of care than the Psychiatric Institute offers, but that is still safer than what can be provided in the community. So that's the beginning of a journey with this bill, and it'll be interesting to see how that develops. And then the second bill that I'm keeping a close eye on is House Bill 96. This is a bill that would establish a direct care workforce advisory board in response to the federal Medicaid Ensuring Access Rule. We've talked about the Ensuring Access Rule in many forums before. This is a federal rule that, among other things, requires wage adequacy for personal care services providers and home health care services providers, home health aides specifically, not home and community-based services, but personal care primarily. You may have heard of this, is referred to the 80% rule. That is, for 100% of the Medicaid rate that's paid, 80% of that rate needs to go out in the form of a wage to the direct care worker. So this bill seeks to match the state up with that federal requirement and ensure that the state is following that federal rule according to the timeline. Yeah, so that rule would create a board that would oversee that work, and keeping an eye on how that just got a hearing last week, and we will see if it moves along. So let me pause there. I've been talking a lot, and I have a few more updates. But Kat, is there anything, any questions that I should?
No questions. I think folks are joining late.
Okay.
Folks just trying to join now, but that's okay. No, there's no question.
Okay.
Unless you want to pause 1 second for all the folks that are in right now. Anybody has a question for Tony about what he has said so far? We'll circle back. Nothing right now.
Okay. All right. Yeah, just a few more things. Guidehouse. Guidehouse is the vendor that we have contracted with to do the work of analyzing our Medicaid rates and the methodology that goes into establishing those rates. You might recall that when we last rebased rates in 2022, and we conducted the public comment exercise, we heard a lot that people felt like the process through which our rates are determined is flawed. It had shortcomings. And the commissioner listened, and she put together a RFP, a request for proposals, for someone to analyze the department's Medicaid rate methodologies, and that's how Guidehouse won that contract. So care coordinators, I know a number of care coordinators have been participating in the work groups with Guidehouse directly about just, sharing with them, sharing with care coordinators the information that we have gotten as we've surveyed people and getting feedback on some of the findings. That process continues. Trying to do a lot with getting input. And last week, there was a listening sessions for people who receive the services, and we just wanted to hear from them. I got off the call so people could speak freely with Guidehouse about the Medicaid rates for home and community-based waiver services and personal care. And it was great. We had a good turnout this morning. We were reviewing some of their feedback, but we still are on track to close up this whole process by July for this first stage of the rate methodology study. So we are expecting around July for Guidehouse to present to us its findings. So that's moving along, and just really want to express appreciation for anybody who participated in the process by filling out the surveys about care coordination, or maybe attending a listening session or work group with them. I'm at least pleased that they're being really careful about getting all the public participation being as transparent as they can be. So that's going well. Regulations wise, there's a couple of regulations projects that are in various states. I just thought I'd mention some of these. Employment services. We did some updates to the employment services regs. They are now sitting with the lieutenant governor in the final stage, where the lieutenant governor just needs to sign off and say these are adopted. So we're expecting that to happen at any time. We are still working through some other projects. There was a regulation project that we put out a couple of weeks ago for public comment. It was regarding licensed foster homes providing home and community-based services. This was issued by the department to make it clear that a licensed foster home providing services to children with complex care needs is not the same as a residential child care facility. As we get into serving complex care needs kids better, Um, there might be there would probably be needs for hourly employees to come in and work with the children, and we just needed to make sure we were not crosswise with what foster home expectations are versus residential child care facility regulations. So we got public comment on that. We got some. We've looked through that, and that project is continuing to move through process. Um, yeah, a variety of other projects. As some of you know, we've been trying to make improvements to our residential habilitation services. That's work that continues. We have work to do around infant learning program, the general relief program, adult protective services. We have quite a log of regulations projects that we are still continuing to work through. It has been 5 years since 4 of our 5 waivers were renewed. So in the coming year, the managers at SDS will be working on the renewals to the waiver, all the waivers, but the individualized supports waiver. So July, we're going to begin that work. Then we'll have 1 year to get it done. And as part of that process, there's a public comment period where we would put the waivers out there, invite your public comment about things that need to be tweaked for the waiver applications that are on file with feds. So that process will be beginning this summer. And the last thing I'll say is keep an eye out for a newly designed Department of Health web page. The communications team here at the department has been working hard to create a more user-friendly web platform, and they've been working hard at that. And I think you'll be seeing that premiere very soon. So the idea is to make it more user-friendly, to be more responsive, to be better to look at when you're on your phone as opposed to a computer screen. So just be aware. We'll put out an e-alert when that is ready so that people can be sure to check it out. Yeah, well, that's what I brought with me today, Kat. I'm happy to pause and hear what questions people have or thoughts that they'd like me to be aware of as director of SDS. I will say Kat does a great job of keeping me informed about what is on your minds as care coordinators and kind of the things that she contends with and trying to help your work go more smoothly. So yeah, Kat, that's it for me in terms of what I lined up to talk about.
Thank you. It's a smaller group than we anticipated. I'm just going to acknowledge that. I don't know if this is a spring, April Fool's kind of thing. I don't know what's going on, but it's a smaller group.
They heard they were getting the booby prize today.
I promised you crowds, Tony. I'm sorry I did not deliver on the crowds that we have seen before. But Heidi has her hand up, so I am going to let Heidi speak.
Greetings. This meeting violates my no meetings on sunny day rule. No, I'm just kidding. But I had a problem getting in on the link, and I was emailing Kat and I'm like, something's wrong. I can't get in on the meeting. So maybe that might be something that has happened to other people. I hope not. But I was just going to say, I really find Kat's assistance useful. Amazing.
Oh no.
Was I muted?
Cut out.
Can you hear me now?
Yeah.
That's a good technique. I bet my staff wishes they had that. No, I'm kidding. But I just really want to say I really am very thankful for Kat. I feel like I probably abuse it more than other care coordinators, and I probably ask her about 60 questions a week. And I'm sorry, Kat. I don't know why. To some of the times I can't find the answer. But I really also really want to say I appreciate her sending out the monthly DPA list, because we're not always getting those DPA lists timely. And I feel like her sending that out really does help us to be proactive with our families and, try to help families take more ownership over and responsibility over getting their DPA applications in on time. So thank you for Kat, and thank you for all your hard work, Kat. And I promise not to be a repeat offender.
It's not trouble at all. No trouble.
Thanks, Heidi. Yes, I appreciate Kat too. Yeah, way to go, Kat.
Any questions for Tony since we have him for few more minutes, and that was the time to ask. There's some burning questions you guys have. Or comments. Nothing. We'll give folks a few minutes to maybe think of something. And I will send a reminder out about how to get in to the info shares. And thankfully we are recording this and we're going to have it posted so folks can watch it and listen in. But I will send a reminder to get in.
Do give us a little time to get it posted, okay?
Kat, does the meeting, the info share typically go an hour?
Typically, yeah. I mean, if, we try to do at least 30 minutes if it's something super short, but typically an hour. But if we don't have enough content for an hour, we don't have enough content. We're going to keep folks here just to be here for an hour. So if there's, I'll give folks maybe until 2:30, and if there's really no comments or questions.
Cassandra, when is the Full Lives Conference? I won't be there this year.
It is next week, April 10th, 10th through the 11th.
Okay. Yeah. I know the Commissioner Hedberg will be there to do the awards. That's always such a nice event. The Direct Service Professionals Awards. That's awesome.
And I know, Heidi, you have a question about the rate study, and Tony had already kind of addressed it before you had joined. I don't know if Tony, you want to just do a quick update for those who came in late. We had about 10 folks join a little after you had talked about the rate study.
Yeah, sure. Yes, yeah, Heidi. I let people know that the rate study is on track, and I thank the care coordinators who have participated in that process. I was on one of the care coordinator work groups a few weeks ago. There was great questions and discussion, and I tell you, Guidehouse is really folding all the input they get into what they bring to us. We meet with them every other week, and we go through some of what they're learning. Some of the data they're getting. We realized that there was a hole in the study and that we didn't hear enough from you guys all know the agency that provides nursing services in Alaska. And so they have gone out of their way to make sure we're getting input from that private nursing agency. And that's been really productive to hear from them, hear about their challenges. So yeah, it's proceeding on task. I mentioned that we did a listening session last week, 2 listening sessions for recipients, specifically for recipients of services, and Guidehouse this morning went over some of that feedback with us. Not a lot of the input the recipients gave us was specific to rates, but it was really good to hear about their challenges in terms of getting services if they live in rural areas, and specific challenges they have there. So it's all real helpful for helping Guidehouse form its impression of Alaska and what needs to be improved here. But last thing I'd say is, yeah, the Guidehouse says they're on track to finish this survey up by July. And then, they'll make recommendations to the state, and then we will see how the state responds to those.
Any other questions? Well, there's a question about DPA not being responsive as well, about how to get DPA. There's a comment about DPA, DSM, and DPA not responding timely and taking a long time.
I can pass that along to my counterpart, Director Etheridge. There was I know that they put together a protocol that they were hoping was going to result in better responsiveness. I'll check in and see how that's going. And I'll take your comment to them. So thank you.
Okay, Heidi, you're back up.
I'm sorry, Tony, I'm not trying to put you on the spot, but I do have one question, or kind of an idea / question. I used to go to that weekly meeting with like Tammy Wilson and OCS and like the really difficult, and you've been to that meeting before too, where it's like the difficult cases. And I suggested at that meeting that we either like come up with some sort of process, like written down process for care coordinators to follow. Because I have been a care coordinator for a long time. I've done that like maybe once or twice. And I feel like it would be a really helpful thing to have for other care coordinators after us, like to try to jump through all of the hoops. Like, for example, this kiddo was transitioning from API and we had to have 30 days worth of 24-hour care calendars. Like, that's kind of a big ask if you don't know that at the outset when you're doing that planning meeting to discharge from a higher level of care facility. So I was just thinking like some sort of like just a little template that care coordinators could use when they're trying to do these really difficult cases that we might come across 5 or 6 times in our lifetime, um, would be helpful. And I think it would save the state a lot of heartache and care coordinators a lot of heartache, because I felt like so many times in that process I was trying to reinvent the wheel, and I'm like, I know more people do this more often than me, and I can think of a handful of care coordinators that are constantly trying to place those variance type cases, that could probably be the experts in helping draft something up. But I think it would be a huge, just like it could even have a little section in the guidebook where, like if you have a specifically difficult case. I mean, I don't know. I just feel like we have the resources and it's just not getting communicated in a way that's able to be digestible by many. So just a thought on that.
Thanks, Heidi. Yeah, you and I have been in a couple of meetings on particularly, excuse me, particularly intense cases where it didn't seem like there was any services available to a particular individual, often a child. So what I hear you saying is that it kind of is hard when you're asked to come into a meeting and you don't have some background, or are you thinking more that you'd like to have something that helps with the referral process into that committee process?
Well, I created a spreadsheet of like all the out-of-state referrals that we sometimes place kiddos at, and I found that to be a useful technique and tool, like in training the care coordinators that work for my agency. But I feel like that should be shared, and I don't mind sharing it with anybody, but it'd have to be updated. But the truth is like I feel like that information should be out there and easily digestible to other care coordinators. And like this is the process. Like even like I learned a couple weeks ago, to get a kiddo into an out-of-state referral, you have to have 3 in-state denials, and I had to call Tim Brown, who I got his name from somebody. Like, I just feel like there should be a process delineated for like these difficult cases where we are getting we're getting more and more people like almost at crisis level. And I want to be 100% transparent. We're making those referrals to OCS, but frankly, nothing is happening. And I don't know if that's just me, but I know they're short staffed too. But I feel like I want to do a better job on those cases. And I feel like the state and you particularly have been super responsive when we've come up with ideas to help solve the issues, but we're not there yet, I guess is what I'm saying. And I know that the specialized family hab homes, I've talked to a few providers that I'm trying to sweet talk into like providing that service. And they're like, we're there, we're close, but we're not there yet. So I feel like there needs to be some sort of like process or way that they can give their feedback back to the state. Cause I think it's a great idea. I think it's a solid plan, but I'm just impatient and I want it to be there tomorrow. Cause I get these moms calling me crying and I don't know what to tell them other than help is coming eventually, but like
processes.
I don't know.
I appreciate that, Heidi. No, and I really appreciate the work you do. Here in Southeast Alaska, we have particular need for services to keep young people in particular here. And I know that means you end up having to deal a lot with providers in Anchorage, providers in Seattle, all over the map because of the lack of things that we have here in Southeast. I appreciate this, and what I kind of hear, what I'm gathering from your comments is, maybe we could stand to do some education in terms of how this, excuse me, complex care work that the department is undertaking is going. and where that the care coordinators involvement can be, where we can work together better. So I will take that back to the complex care group. Anything else, Kat?
No, I don't see any other questions. There's some specific questions about Harmony that I'll address later. And then I guess if you are taking notes on the complex care, this would be, there's a comment about what would it take to move the process along. I don't know, Oni, if you want to take yourself off of mute and kind of explain what you're saying. Great.
Hi, Oni here. Question. I was just curious what it would take for care coordinators to be automatically notified when a support plan is pending DPA, and if we could be essentially given what's needed so that we can get that process moved along a lot quicker.
Oh,
Thanks. Go ahead, Kat.
We don't have a way of doing that right now because we don't know how long it'll take for DPA to get to that plan. The only notification right now we have is if DPA denies, right? If DPA denies the plan, you get a tickler, and then it's not been consistent, but typically DPA will put a comment in, and we could go over specific cases if you have questions that will say what's missing. And our SA team as well can also check what's missing. But if it's pending DPA approval, we really don't know how long it'll take, and we have no way of notifying care coordinators that only once DPA denies, you'll know. And then if DPA approves the plan, then it goes to SA, and then you get a pretty quick SA. So we don't really have a way of doing that right now, but I'll bring that back to the Harmony Health team for any future kind of maybe enhancements. And Heidi said that you need to submit the metro. Thank you. Any other questions for Tony that are that's something that Tony can answer? And
this is John.
Yeah. Oh, go ahead.
Hey, Tony, you mentioned that the website's going to be rolled out here in the near future. I was curious if the agency's policies and procedures would be posted on there like they have in the past, if they've been updated. I think they've been going through an update process.
Hey, Jonathan. It's been a while since our policies and procedures have been up there, and I understand this is one of the things that was interesting for me when I came to SDS is that our work really proceeds through regulation, and the policies and procedures themselves, I think, had gotten pretty outdated, which is why they came down. Is Kat, does that sound accurate to you?
That sounds correct. Yes. Yeah. And are you and are you asking for a specific one, or Jonathan? I don't know if it's a specific one you're looking for. But
yeah, Jonathan, was there a specific policy area that you were wanting to read up on?
Different one on different days. So
yeah.
Jonathan, are you asking for our policies and procedures, or are you asking for like different agencies' policies and procedures?
SDS's specific policies and procedures. Those the ones spelling out how they process documents, things like that. So much has changed over the past 10 years. And I think the last refresh was like back in maybe even 2007, in some cases. So I'm just curious if internally those have been refined, and if they would be posted externally. If they have,
I'll be honest, Jonathan, they have not. They have not. Regulation has kind of taken over as the operating guide to how SDS works. I know that there are many areas where, some deeper guidance would be really helpful. But just given the press of other things going on right now, that's not on our list.
Understood. No problem. Thank you.
Now, it pains me to say that, but it's true. So got a lot. We recognize we have a lot we need to fix.
There's also a specific case question from Heidi about CFC, and I'll follow up with you, Heidi, without an audience on that. That's okay. If that's okay. Okay, it's just a quick time check. It's 2:41. We don't have to stay a whole hour if we don't have the content to talk about that. But any last questions, comments for Tony? Give folks a few minutes to think about it.
I want to say, Kat, it's been really cool for me the last several weeks. A lot of groups have come to town. Key Coalition. There were a lot of care coordinators here in town for that. I got to spend time speaking with, and it's just great to spend direct time with people, hearing about their work. I tell you, I am so struck by the variety of feelings people have about the various things we've done with care coordination over the past few years, really coming out of the pandemic. We've seen some changes, right? We've changed up the contact requirements. We've changed up Zoom and the short form and things like that. And I will tell you, I just hear a range of opinions on these things. And some people love them, some people don't like them at all. And it's just really great to hear both sides of a policy change. And it's really been fascinating for me to hear, different feelings toward these things. So it's challenging, and I know we can't always make everybody happy, but it's just been really great to get direct feedback from people who've been in town. That's one of the real things I like about the legislative session is brings people to town, it gives you direct FaceTime. And so I just the involvement that care coordinators are having in things like AADD and Key Coalition and other things like that, it's really welcome for me. And I appreciate Kat, you fitting time in for me here today. I will not let as long a time go by before we do this again, and maybe we'll do it further away from full live, so there's not conflict or misunderstanding.
We'll make sure to announce it to folks. Get a bigger audience for you. But any last questions for Tony? Thank you for coming, Tony, and we had some thanks in the chat as well. This is going to be, like we said, we're going to put it up on our Academy. It's going to be on YouTube and probably sometime next week, or maybe actually the following week, because it's full lives next week and we're going to be kind of busy with that. So give us some time to get this set up, and you might get some follow-up questions, Tony, from folks who are maybe not here and who get to view it later at a later date. So just heads up about that. But any last questions for Tony, guys? Cassandra, anything that I missed maybe in the chat? I don't think so. I think we got everything. But thank you for coming, Tony. This was great.
Thanks, everybody.
Yeah, we got a bunch of things in the chat, so I think we're good. All right. Well, thank you. Thanks, everyone. And whoever's coming to Full Lives, I'll be seeing you there. And if not, office hours are canceled next week because we will be at Full Live, so we won't have office hours. But you can still email us and call us. Thank you, everyone.
Thank you, everyone.